Hey guys, it's HINA Chef here at Rebalance Physical Therapy in Center City, Philadelphia, as well as on the main lines in Narberth, Pennsylvania. And I am a physical therapist that uses a holistic approach along with functional medicine to improve our patients that are dealing with all sorts of orthopedic issues, but especially spine, hip, and pelvic floor issues. And today I wanted to answer a question that one of our clients called to ask. And her biggest concern is, I have a diastasis recti and I'm concerned that I'm going to get a herniation. Is there anything that you guys can do to help prevent this? And so absolutely. So with a diastasis, what ends up happening is you have this splitting of the midline. And for those of you, that do not know what a diastasis recti is, I have another YouTube video that explains to you exactly what a diastasis is, how to kind of self-evaluate yourself, and what can help. But in this video, I wanted to take the time to talk to you about this particular question that this female had. So with a diastasis, basically it's where the abdominal muscles, especially during pregnancy, but this can also happen in other individuals, okay? And not just obese people, but it can actually happen with other clients who tend to, or people that tend to work out a lot and have, work through their abdomen quite a bit. So basically you can get this separation of the abdominals away from the midline. So I was explaining to this client of mine that it's kind of like when you think of a corset that's kind of tied in the front. If that corset in the front, if that tie starts to untie, you're going to have this separation of the abdominals from what's called the linea alba, which is this tendon in the middle of your abdomen. And when that split starts to happen, then basically that's a vulnerable area for your organs to be able to basically push through the wall of your abdomen. So yes, when you do have a diastasis, it could make you vulnerable to a herniation. Now, what can help is if you retrain that musculature along with other musculature that helps the deep abdominals to bring that corset back together. In other words, to bring that tie in the front back together so that when you are doing exercises such as abdominal exercises, or if you're doing Pilates, if you're doing CrossFit, if you're working out, if you're coughing, sneezing, anything that puts pressure in the abdominals, if that corset isn't staying closed, then what you're going to have is you're going to have this opening that ends up happening. And so anytime there's pressure in the abdomen, you're going to get this bulging that sometimes looks like this midline kind of speed bump, or it looks like something's protruding out in the midline of that abdomen. And we want to prevent that because that is abnormal. It's not a good situation for that to be happening, because over time, if you keep seeing that, okay, this midline kind of speed bump happening that's vertical, then that can just make you more susceptible over time for a herniation through the abdomen. You'll usually see that for some people, the umbilicus, okay, or the belly button starts to protrude out. And you might even start having some tenderness along that area. So it's really, really important, especially for those that are already starting to experience back issues, other pelvic floor issues, hip issues, and those of you who especially work out or do heavy lifting or anything like that, that you definitely get this treated, because we need to bring that corset back together, or teach you along with other musculature to help bring that corset back together. Because when that corset is back together and then you sneeze, cough, lift, do Pilates, CrossFit, any of those things, then you're going to create better core strength, which is going to be good for a whole host of other things. So to answer that question, yes, you can. For those of you who are having a diastasis, you can be susceptible to hernias and herniations through the midline, but there is treatment that can definitely help this. And for some, if it's a real significant diastasis, sometimes this could be a surgical consult. And oftentimes I do hear that patients will go and they'll go contact a surgeon to do an abdominoplasty or something to help that diastasis, but they've never looked at physical therapy by someone who truly understands how to rehab a diastasis to bring that together. They've never even looked into it. And then a surgeon will say, hey, yeah, we can fix this and we can bring it back together. Now, true, they probably can bring this back together, but here's the thing. You know, you're talking about a lot of money to fix that. And then number two, your abdominal muscles still might not be functioning the way that they ideally should be even after surgery. So I tell all of my clients, the first line of defense should be that you really have someone who's skilled and knowledgeable that understands how to rehab a diastasis appropriately. And then there's many tiers on how to bring this together, not just doing a bunch of abdominal exercises, but it's a whole slew of, you know, everything from working on the diaphragm, which is the muscle you breathe out of, to your pelvic floor, to your back muscles, through, and as well as your abdomen, as well as many other things, including alignment, to help bring that, again, that corset back together. So if you live in and around the Philadelphia area, around the surrounding suburbs, we deal with rehabilitation with diastasis all the time. And this is a specialty area of ours. And so if you find that, yes, I want to have this work done, jump onto our website. It's rebalancept.com, REBALANCEPT.com. We have lots of other, you know, sign up for our newsletters. If you feel like you want to come in and have this looked at and have it treated by one of our practitioners, then great, sign up for possibly a phone consult and we'll decide who will be the best person for you to see potentially and what we can do to help you. And then, like I said, we have lots of other YouTube videos that explain much more in depth what a diastasis is and how to self-assess. So I hope this video was helpful to some of you who might be worried about that. And I hope all of you have a wonderful day. Take care.